No matter where you live, no matter how old you are, climate change can affect your health. We must act now, and the first step is understanding how climate change can affect health throughout a lifetime. Air pollution is on the rise across the Southeast Asia region. Even before they are born, babies in utero are affected by high air pollution levels and are more likely to arrive prematurely and at a low birth weight. Respiratory infections are already the top cause of death in children under 5 in the Southeast Asia region. Rising air pollution levels will make small children more vulnerable to respiratory infections and asthma and lung disease later in life. For adults, air pollution will also exacerbate heart and lung disease, stroke, and cancer, which already account for more than 60% of deaths in the region. Overall, unmitigated air pollution has already been shown to reduce life expectancy. Extreme heat is very dangerous to human health. Babies in utero in early life exposed to above-average temperatures are likely to have fewer years of schooling. For adults, rising temperatures can cause heat stress and heat stroke, as well as heart, kidney, and respiratory failure, potentially resulting in death. This is particularly risky for adults who do strenuous work outside, as well as older people who often cannot sweat effectively, making it difficult to cool the body. Diarrheal diseases, already a major health risk for children under 5, may become a bigger concern with more frequent and intense floods and droughts that can increase waterborne pathogens. Disasters also place children, especially teenagers, at risk of post-traumatic stress disorder and behavioral problems. This is especially true of flooding, which often involves physical displacement and long recovery periods. Climate change will also impact the world's food supply, with projected declines in staples like rice and wheat, declines in fish catch potential, and lower productivity among cattle, pigs, and poultry. This will have an equally stark effect on human nutrition. Higher levels of carbon dioxide in the atmosphere are also likely to reduce both yields and the nutritional value in key crops. Combined, this will affect child nutrition, worsen micronutrient deficiencies, and increase the risks of stunting. Changes in precipitation and temperature will alter disease patterns, with cases of diseases like dengue expected to rise in many countries in the region. People of all ages are at risk of vector-borne diseases, but the elderly are more likely to die or suffer severe symptoms. As much as health vulnerability to climate change is about people, it is also about the systems that support them. Hospitals, clinics, and other medical facilities are susceptible to destruction, damage, and disruption during storms and flooding, and are also vulnerable to climate-driven shifts in disease patterns. Without proper preparation for the impacts of climate change, healthcare services, including essential vaccine programs, may be interrupted, with impacts on the health of people of all ages. If we don't take action, health outcomes will get worse, but it's not too late. If we act now, as individuals, as communities, and as nations, we can ensure a better future for this generation and for those to come.